coming on to how quality is affected by leadership. And we have a very nice presentation by Dr. Shahid Latif. He is a consultant psychiatrist and the clinical director of Northamptonshire Healthcare NHS Foundation Trust in psychiatry, I believe. He also chairs the Royal College of Psychiatry Transcultural SIG, and he's a clinical supervisor and a trust appraiser. And he's going to talk about the psychology of leadership, how mentorship improves decision-making as healthcare professionals. So, Dr. Shahid Latif.
Thank you very much. It's a huge topic, and I don't think I can do justice to it. So what I'm going to do is I'm just going to focus on the relevant points and just give pointers more than feed you with detailed information. It's a very interesting area. There's a lot of research and a lot of evidence base which has been discussed and which has been explored. So in the time that I have, I'm just going to touch on main points, and at the end, if anyone wants to take questions during or after presentations, they most certainly can. So leadership, basically, what is leadership? Everyone in this room is a leader in some capacity, in some form, and we need to understand where we are the leaders, where we focus, what our areas are, whether it's organizations, whether it's committees, whether it's teams, whether it's family, and we all provide some form of leadership in maybe we don't even know it at times, but it's always present and we're always in that process. So when you look at these theories, when I go through them and touch on them, just keep in mind yourself, be self-aware, and just ask yourself, which one do I fit into? Because one size doesn't fit all. So when we talk about these theories and traits, it's different strokes for different folks, and I'm going to try to keep it as simple as possible. So these are the traits, so we'll go through them one at a time. The first one is the trait theory. So what does the trait theory talk about? It's the traits approach, which basically looks at individual qualities. And individual qualities are how we are as human beings, our personalities. And this is something which comes under here. The other one is a situational approach. Situational approach is our roles. Now, again, think about your own role in your specific organization, in your specific team, etc. And think about, I have these qualities, but do I apply these qualities to a certain role, or do I have to readjust myself? So these are, the trait theory talks about these different kind of approaches. Stoddel in 1974 spoke about certain qualities within individuals. So what are those qualities which require an individual to show some form of leadership? Or, in other words, what Stoddel said, although I don't agree with him completely, and I'll tell you why in a moment, he spoke about the consistent factors which leaders have within them. What are they? They're intelligent, self-confident, dominant, sociable, achievement-oriented, older in age, more experienced, and I just don't like the next one, taller. Completely disagree. So this is something, these are theories basically which are touched upon. So look at some of the leaders. Now, when I talk about leaders in the world, they may have played a negative or a positive role, but look at these people. Who's that? He's probably shorter than me, this guy. Adolf Hitler. Whatever you think of him, whatever his reputations around the world. Who's this? Yeah? Good old Churchill. So you see, these are world leaders. So Stoddel, when we talk about different qualities within individuals, does it really fit? Not necessarily. When you look at these people, how intelligent were these people? Then you have to define what intelligence means. So it's a broader concept. Brown and Turner furthered in and spoke about there not being any consistent traits within leaders. And he's saying, they spoke more about it being situation dependent, that if I'm in a situation right now, in an hour's time, I may be asked to do something and I may provide the leadership in there. So again, it redefines leadership. It doesn't necessarily mean that if you've got your name on the plaque and you've done so-and-so and you've accomplished it and you've had a publication, therefore you're a leader within the field, which we'll come back to in a moment. So leaders can do certain things within the boundaries or confinements of which they're in. When I was doing my interviews, or when I assist doctors to prepare for consultant interviews. And leadership is a question which comes up very often. And some of the things I talk to them about and really try to instill is that leadership is not necessarily showing that you are leading from the front. True leaders can sit back. They can lead from the back, from behind, not be seen, out of the scene, which we call sometimes as kingmakers. Fine, it can be a negative or positive connotation to that. But are they leaders in the true sense? Are they make things build in a certain way? Do they develop? Do they provide capacity? This is the leadership, which on a broad spectrum, which we really want to think about here, and which at the end of the day, it ties in really, really well with what the theme is today, and that is quality, improving quality. That's what leadership, again, what it should be. So Bale furthered, he spoke about experts and depends on functional demands. Again, I'm going to come back to that in a moment. What are the behavioral theories, styles? Democratic, autocratic, laissez-faire. We're all probably aware of this. Most of you in this room will probably, who have an interest in leadership and have studied some of it, have probably are aware of these factors. Democratic leaders. What happens within a democracy when people become, allows people to choose through elections. The whole process of that leader, what they do is they're participatory, they bring people on board, and they encourage others. The only negative about the democratic style of leadership is that decision-making process is long drawn. You all must be aware who work in different organizations. I'm going to talk about the NHS being in a management role. When we do have to change policies, we have to go through a process. Now, sometimes a policy, sometimes things that we have to do, we have to make quick decisions, but we can't because there's a lot of red tape. We have to go through consultations, etc. And when we do those, because it's a democratic manner, it just prolongs and delays things. So that's the only negative with the democratic style. Then we have the autocratic or the dictatorial style. Is it good or bad? I mean, person is chosen as opposed to elected. Decisions are very quick because the person who was there, who was chosen, can automatically make decisions without discussing with anybody. And it may be less efficient as a result because there's no criteria there for the process to be reviewed. Again, it's dictatorial, poor consultation, less creative because the people who are working with you may not be motivated enough to work because they know that they are working for somebody, and there may be leaders within there who are not given the opportunity to develop. And it can be quite critical as well because of the process itself. And then we have the laissez-faire approach, which is basically the laid-back approach. Has its positives. Leaders can be laid back. They can take a backstage by being delegative. Now, these are leaders who work with experts in their areas and who knows where skill mix is. So delegation is really important for them. And it works, as I said, for highly skilled teams. Self-problem solving is encouraged, and that's why people can be more creative, and it is a hands-off style. What's the negatives of it? There may be a lack of role awareness. There may be low accountability, and there may be passivity and avoidance from the followers if there is not a good awareness of roles. We have the contingency theory, which is described by Turner in 1991, who says basically, you don't need a specific personality for it. Anyone can become a leader. You just have to be at the right group at the right time. And the appointment, and you may be appointed as a leader. And that's what is also called the emergent leader, where you just have a specific individuals being in a certain group, and something comes up, being at the right time, and that's where a leader may emerge, or certain qualities may be picked up. Power and influence. French and Raven spoke about this in 1959. Very powerful and very, very relevant and important. What are the different forms of power and influence theories that they have on leadership? Legitimate power, reward power, coercive power, expert power, referent power. What is legitimate power? Legitimate power, beg your pardon. Presidents, chief executives, etc. They have the formal right. How they got there, God knows. Trump, take an example, leader. Okay, so he has the formal right to make decisions. He's a leader there. But once that position is gone, that position of leadership goes. Reward power. Again, managers within companies, they have the opportunity to maybe promote somebody, give them a reward, give them a bonus. So they give compensations for compliance within the individual. However, if the reward is not accepting and is not large enough, then it may become the followers may be less effective. Coercive power. People who are in a position to punish someone, dismiss them, fire them. So obviously this is a form of power and puts them in a position of leadership as well. And then we have the expert power, people in this room. who have skill and knowledge within their certain skill sets, and the referent power. Referent power basically refers again to personalities, and personalities who are well known. We can talk about celebrities here, worthiness, reputation, people who are articulate, charismatic, motivational. You can take your own pick who comes to mind, but there must be someone out there who you look up to. For you, you may or may not know it, but they're in a role of leadership for you, because in some shape or form, we do follow people, we have role models, and they may not know it, but being the charismatic personalities they are, in a way, they are in a position of leadership. And later, with the advent of media, and particularly social media, there has been another form of leader which has come to the fore, which is called the informational leader. And informational leaders are those who have power and control over media and social media. And the power that they hold is phenomenal, and it's growing. And this is something that we've, not much work has been done at the moment, but the amount of work that is being done in the coming years, it's going to be phenomenal how the leaders in this area are going to take off. And that's why it's really important when we talk about quality and the whole, it's already been touched on about IT and how we use information technology within our own specific fields as well. That will be very, very powerful, and that's where we bring out our leadership and develop teams. We move away, but how do we then bring in the next generation to be able to utilize that? This is where informational leaders come in. So which one is the most effective? These two are supposed to be the most effective forms of leadership. The person who's in a position of who has referent power, as we spoke about, who has affiliation, people who we follow, like celebrities. They are more powerful when combined with expert power. Now, I was just listening to one of the TED Talks on leadership a few months ago, and surprisingly, I saw Shah Rukh Khan on TED Talk, and he was talking on leadership. So he's a celebrity, he's well known around the world, he has the referent power, but also he developed the expert power in leadership, because he's done so many talks on leadership that he's become an expert at it. So the combination of the two is so powerful itself. So this is something for us to think about as to when we already are expert in this area, but when we put ourselves in a position of becoming well known, how we sell that and combine the two and how powerful it is. And the expert, obviously, is someone who has good understanding, good evidence, experience, knowledge, confidence, respect, and rationale. I'm just going to fast forward slightly because I'm just conscious of the time. So by recognizing the different forms of power, one can avoid being influenced by those that use less effective ways, and by developing expert and referent types of power, one can establish influential, effective, and positive leadership skills. So it's leading from the front. In order to do that, one has to be effective and motivated, and a team requires to see you as an expert, respect you as an expert, and trust your judgment. And believe me, many people may think that a leader has these already. They don't, not necessarily. So how does one gain expert power? Most of us are doing this already. Promote an image of expertise, maintain credibility, confidence, not arrogance, and there is a thin line between the two. Be decisive, keep yourself and others informed, recognize subordinate concerns, very important, and this sometimes which we miss the trick. Avoid threatening self-esteem of the subordinates, again, looking after your team, they're very, very important. So all this put together, if you think about it, is what we call a transformational leader. If we want to be a complete leader, we need to be in the stage consistently and persistently and perpetually in a transformational stage, because we learn every day. We're students. We're maybe calling experts, we are students, and we're students of ourselves. So in order to become that, we need to maintain our integrity, set clear goals and visions, be communicative, lead by example, expect best from our team, encourage and support others, and help people to see beyond their self-interest and focus more on the team. So you see, a transformational leader focuses not only on themselves, but also understands those around them and is able to inspire individuals. In other words, being a smart leader. That's my theory, by the way. Just going to fast forward. Then we talk about dimensions, about this different individuals may focus on concern for people or concern for output or production. Now, I'm sure if one is more than the other, it will have an impact. The best is to have a balance between people and production dimensions. And lastly, I would like to touch on emotional intelligence. It will be unfair if I do not talk about emotional intelligence without completing this talk. So what is it? It's the ability to manage one's own and others' emotions, self-awareness. What am I thinking right now? What impact is it having on myself and those people around me? Very, very important for leaders. And ability to perceive others' emotions as well. Goldman speaks about self-awareness, self-regulation, and motivation, empathy, and social skills. I can go on about emotional intelligence, but I think because of the time, I'm going to stop right here. Thank you very much.